Over the last month or so, I've been working with a fantastic pelvic health physiotherapist, Maria Elliott. Together, we've been looking at how breathwork, yoga, and physiotherapy really helps endometriosis. For the final part of our 4-part series, I went along to Maria's clinic for treatment and to find out how physio relieves endo symptoms. Maria starts with manual therapy and moves to an LPG machine. Keep watching to find out more.
How are you?
So I've had a really bad flare-up. Wednesday I was in bed all day, getting this awful pain in my spine about here.
Okay, so that right side,
Yeah.
which we're familiar with,
Yeah.
aren't we? Because you get
It's
that
like-
right-sided spasm, don't you? Okay.
Yeah, it's like someone's just stabbed me in the back. Then everything flares. The pain is, it's like being in labour.
Okay.
I can't move, and I go to faint, and it goes down my leg.
Okay, so that's all
And
that
it goes-
pressure that builds up
Yes.
there. And it's always the right side?
Always.
Do you get any pain on the left?
No, but I do into
You
my
get, I was just about to say, you get that
sciatic
back
on my left
of
side.
the left side. Okay.
And I know from my yoga that my left side is tight here. So something's pulling, something's there.
Okay.
That's not
Yeah.
normal to the outside.
And sometimes underneath there is a little bit more overactive or having to work harder to stabilize you because it's compensating for this cross sling.
Yeah.
So we definitely have around the back here, don't we? And then through here. And when that goes into that holding, then isn't it, there's compression on everything on this side, including all the organs. And then you get that pressure. And then once that, I think, passes a certain point, then you'll get that pain down the leg. Okay, well, let's have a feel of how you are today.
Yeah.
So let us start with your tummy. So let's just have a feel of the left side, which gives you less problems, isn't it? So we want to check underneath this diaphragm first. And when you had your surgery 4 years ago, what did they find and what did they
So stage 3 endo, and I'd had my appendix out, so they had found that the appendix scar had stuck to my bladder.
Okay, to your bladder. Wow, okay. And I think that's the thing, isn't it? We see like a little appendix scar, or we see like 3 dots and we think, oh, that looks great, but we don't actually know underneath what's going on. So yeah, here I can feel that everything is tight and tense. So we've got the different layers. We've got the skin, then we've got the fascia, then we've got the muscles, then we've got our peritoneal sac with our small intestines and our cecum and our, we don't have an appendix anymore, but they're all under there. So it's quite a busy area of the abdomen from a point of view of what we find viscerally underneath in that lower right quadrant. Is that okay? I'm not going to.
No, it's fine.
So let's.
And what's the difference between visceral and somatic? Is that the two?
Oh, visceral and somatic, yeah. So visceral is our organs. So anything that gives us pain. So if we had bladder pain syndrome, that would be a visceral type of pain. So the bladder would have inflammation in the wall and can refer pain. So you can get visceral referred zones. So it's the organ that's unhappy, either because of inflammation, infection, or it's in a position that is not happy, it doesn't have enough space. So then that can give visceral pain. So say when you got the back pain, on Wednesday, it started probably with somatic, which is more our muscles, our joints, our ligaments. But once it did this spasm here, then it started to add on the visceral pain. And once we get the visceral pain, then we get an autonomic nervous system response as well. So you can get the fainting, you can get vomiting, you can get palpitations. So you get autonomic nervous system symptoms with visceral pain, whereas generally with somatic, like back pain, hip pain, knee pain, you don't get autonomic nervous system responses. And say the pudendal nerve, which is in the pelvic area, It is one of the only nerves in our bodies that has somatic and visceral components.
Wow, okay.
So if that nerve, if there's something pressing on that nerve, whether it's a tight hip or a pelvic floor, and it gives some irritation of the pudendal nerve, then you can start to get the visceral and autonomic nervous system add-on symptoms. So here, down there, that's more visceral pain, whereas around here would be more of the somatic. This would be like QL and the obliques. So you will have had both occurring, so that's why it felt like you were going to be having another baby. So let's just release this. So,
oh, that's lovely.
So you see that, yeah. When we hear all that gurgling, then that just gives release, and that's your body as well switching into parasympathetic, which we want. And you know, when we're in pain and when women are battling, isn't it, with endometriosis and all the symptoms, they're on, you know, fight, flight, freeze, survival, isn't it? It's all, am I going to be okay? Am I going to have enough energy? How's my pain going to be able to, will I be able to work? Will I be able to look after the children, my partner, and all of those variables? Whereas actually what we need is to be able to do this, which is lie down and release all the areas, because there's a backup here, you know.
Yeah, you can feel it.
By the time you got that spasm on Wednesday, there will have been things building up. And then when things settle down again, you can settle down and come out of the pain, but actually unless you release everything right down, then you can go back over that.
That's it, isn't it?
Pain.
Because I haven't seen you for
I know.
since October. I've missed it so much. My stomach is in heaven. The camera can't pick this up, but my stomach is gurgling.
It is.
away.
It's gurgling. The pressure is releasing all on this side. It just feels much happier already.
Yeah.
And that obviously then this all links into the pelvic floor. So often if one side like is really tight and in pain, then the pelvic floor on that side also can still gurgling away there, isn't it? The pelvic floor on that side then also joins the party, and they all get tight and overactive. So then that can cause pelvic floor dysfunction symptoms such as difficulty emptying your bladder, difficulty emptying your bowel, pain when you empty, pain with intercourse. All of those symptoms then can add on.
Why is it that those actions create the pain? Why does that act as a trigger? Just, you know, emptying your bladder.
So often it can be like a neural stretch. So it's like, often with endometriosis, the pelvic floor has got tight and tighter and tighter over time. So it's been a progressive shortening. So then when you actually lengthen it, or when you empty your bladder or your bowel, the pelvic floor has to release and it has to drop. And sometimes it just doesn't like that, because it doesn't like that stretch. So you can get a neural stretch, you can get a muscle stretch, and then you can also, if there's any kind of inflammation going on in the area, which there will be with flares, then just that inflamed area as you urinate or as you empty your bowel can be irritated with the passage of urine as well. So everything's trying to, you know, protect itself. So underneath here is much tighter again on your right side. So it's much harder for me to get my finger in there. That's really tight there. So let's go in a little bit deeper then. So we want to be able to get in underneath there. There we go. And we want you to be able to then get a better breath in afterwards. When the endo's here and you get this holding, you get the bloating, you get the pressure, you get your pain, then here will shut down and here will lift up, and then everything's just stuck and tight. And then often, isn't it, you know, muscle relaxants will help. Often then we have to, as you've done, isn't it, eliminate, like cut right back on everything that you're eating and drinking, just to give it all a rest so it's not so reactive. In the urology world, I work with a great urologist, and he's very proactive in trying not to get that immune system response within the gut. So again, it's working out, you know, which foods that the body reacts to, like antihistamine. So things like, we think that it's great eating all chickpeas and lentils, but actually that can create terrible bloating.
Yeah.
Once we get the bloating, we get the pressure. Once we get the pressure, we get pain. And so it's trying to manage all the variables, isn't it?
It is.
And then over the years, I think with a lot of the patients I've seen with endometriosis, the challenge has been when people are in pain, as you know, there isn't an awful lot that you sometimes just need to accept, okay, I'm going to lie down. Yeah. I'm going to put the hot water bottle on. I'm going to take the muscle relaxant. I'm going to check out if I can, 24, 48 hours, whatever it takes. And then when you do feel a bit better, it's to get going again, to get strong, isn't it? Because
it's also not knowing when, if like at the moment they're considering more surgery, if the endo is growing back enough to have an operation, or do you need physio?
Yeah.
You know, it's kind of, can I go and see Maria and have another 3 months where I can get away without it?
Yeah,
you know?
And I think that's it over the years, isn't it? Often, sometimes when there is a surgical procedure, sometimes there's lots of endo there, and you know, the excision or the ablation, and everybody feels much better afterwards. And sometimes there isn't, and sometimes surgery doesn't change things. So then it's how to kind of differentially diagnose. I suppose what we could be doing, if in an ideal world, and it's challenging with COVID, isn't it, is you know, treating 3 months before surgery, once a week, to try to help or to avoid surgery, and then afterwards as well. Whereas I think there's never any treatment beforehand, and then very little afterwards. And you know, endometriosis patients, people say, oh, physio, you know, what can physio do, because we can't change the endo. But I often feel we can change a lot of the symptoms.
Yeah.
And everybody's endo is different, isn't it? So I think we need an awful lot more research, resources.
For the second part of treatment, a special suit is worn to protect the skin whilst working deeper into the body and improve drainage.
So here we are on the second part of the treatment today. So I did some manual therapy techniques myself, releasing under the diaphragm, releasing tender points in some of the muscles, rolling the connective tissue, releasing the scar work, so that Katie could breathe better, and so that we didn't have this tight band from here, mid-back, going right round to the front of that right hip. And when that goes into spasm, and we know with Katie, when that happens, it's time to take a break and rest, because the pressure builds up really quite quickly and quite severely in the front of the right lower tummy, and that pressure and bloating then gives all sorts of pains, and even pain down the leg. So that's what happens on that side. On this side, we're a little bit tight here, see that? And around the outside of the hip, which sometimes then gives sciatic pain down the left leg. So what we're going to do here is we're going to do some treatment with LPG, which is one of my favorite machines in the whole wide world. I've been working with LPG since 1992, when I discovered it in France. So we use this for back pain, we use it for abdominal pain, but it is really good for patients with endometriosis, because what it does is, you'll see now, it basically mobilizes, it lifts the fascia, so it improves the mobility of the fascia. It releases muscles as well, and once everything is released, then it's easier to breathe. So while we're doing an LPG session, and Katie's in her suit here, so we would do the front, the sides, the back, the legs, we get patients to also then work on optimizing their breath, because we know the diaphragm goes round from the front to the side to the back. So while Katie's on her tummy now, provided she's comfortable, I will release everything that's tight using my LPG machine. And then I will encourage Katie to take nice breaths into the back of her body. So try to breathe in, send that breath down. And although Katie's severe pain from last Wednesday has settled and everything, we now want to get the body fighting fit again so it doesn't get into another spasm. So we want to release everything that's got tight. And so this will also work on, you know, the pain receptors, the mechanoreceptors in the fascia, which are often very sensitive. So we're trying to calm down the pain receptors and the nervous system. And then we're draining as well when there's swelling or inflammation. And we are mobilizing the fascia. And when the fascia, which we often see with endometriosis, gets tight and restricted, we'll get pain. So again, take a nice breath in. Good. And out. After a session as well, it's important to hydrate. So to drink lots of fluid and to move as well. So to get out walking, get some vitamin D if the sun is shining now. So there's different heads for the LPG. So for your legs, I'm going to move over to a bigger head, which covers more surface and is more for draining. So tighten your bottom muscles for me. Good, well done. Very good. Mad what we get up to on a Friday afternoon, isn't it? And then let go. So LPG, as I said, can be used for lymphatic drainage, for heavy legs, can be used for scar tissue mobilization following C-section, following breast surgery, following endo surgery. And let's do the other side. So tighten your bottom muscles again. So when you tighten your bottom muscles, do you get a pain on that left side or not? No. Again, take a nice breath in to the back of the body. And rest. Then, often, what I use as well is my massage machine to release deep in here. So often at the side of the sacrum there, where some of our hip rotator muscles, they get tight, and that also links in with the pelvic floor being tight. So we need to release piriformis, release obturator internus manually, but then also using other modalities. And often when we release externally here, and even the hamstrings, then the pelvic floor internally on that side has an opportunity then to let go and lengthen as well. Compared to the other side, which side feels, oh, that's much so that is much tighter all the way. Woo! Let's try to let that go. Good. And again, keep that breath going. Take a breath in. Perfect. And breathe out. And rest. Then let's turn you around onto your back for me. We'll do a little bit on your tummy. So the adductors here, they link with the more superficial layers of the pelvic floor. So when these are really tight, well, then the entrance to the vagina gets very tight, and then that's when you can get pain with intercourse. Or whereas when the pelvic floor at the back is really tight, then it's more pain with emptying your bowel. So we're going to do a little bit of LPG here as well. on the right adductor that gets tight on you. First of all, just get you used to the LPG on the front of the body. So as you lie there at the moment, have you got pain? No pain, okay. And so basically what it does is, in French they used to call it palper rouler, but it's kind of lifting and rolling, lifting and rolling. So as I said, it can drain toxins, hormones, inflammatory chemicals, but then it also gets that fascia to release so that everything can move. So now we're going to go up towards the tummy nice and gently. Actually, I'll go on your left side first. So again, there aren't any studies done, but somebody was talking about it in Paris the last time I was over, about using LPG 8 weeks after surgery for endometriosis removal, to just, again, it was the study was to do 8 sessions once a week from 8 weeks to 20 weeks after surgery, just to keep everything from getting tight again and getting stuck. You know, because if we have surgery on our knee or even our hip, you know, afterwards we massage the scar, we move the hip more tender on this side, or is it okay? So I think, in my opinion, you know, we don't do enough hands-on manual therapy for patients with endometriosis because we're not quite sure what to do and where to start. But then as a result, women don't get treated, and they don't get their back pain treated, they don't get their hip pain treated, because everybody thinks, oh, that must be endo, and what can we do? So I think we should be. And as you see, we've got like lots of different things that we can use to help as well. And then tighten your bottom muscles for me. Good. And then let them go. And again, tighten. Good. And let go. So the reason sometimes we get you to activate the muscles is so that we can drain anything that's between, say, the skin and the muscle. So whether it's fluid or scar tissue or inflammation. Bend up your 2 knees for me. And just take a few breaths in and out. Roll your head side to side.